My name's Josie Gilday, and I'm the Global Medical Advisor at Save the Children International. I first became interested in patient safety when I actually made an error myself as a nurse. I remember it really vividly even now. I was on a night shift. I think it was the fourth night. Me and a colleague were setting up a syringe driver for a patient. We needed to both do it, and we did it wrong. And I remember filling out the medical incident report. I remember, apologizing profusely to the patient. And I remember being absolutely distraught, like heartbroken, like I can't continue to be a nurse. I can't believe I made such a big error. My colleague was the same. And so the pain team were like, oh, we just wanted to have a quick chat and let you know that actually we've already recorded several errors with this machine. You're the eighth nurse. We're waiting for 10 nurses to make this mistake. And then we have the data and the pattern to show that this is really a patient safety issue. I'd never thought about patient safety until I made that error myself. And then being made aware that other people were making the same error, and that possibly I'd been allowed to make that error because we hadn't quite got the data or the pattern needed to protect the patient and myself from making that error, just kind of blew my mind. And so I was like, okay, right, hang on, do we really need 10? And can you explain to me more why we need 10? And when was it first spotted? And how long in between the errors, and which nurses are making them? Because obviously there's more to it than just necessarily the machine, whether we were all on night shifts and we were all tired, and things like that. But it really opened my eyes. And so it just was like, right, okay, this is going to be one of my focuses from now on. I think, patient safety always is, but you just take it for granted that everything's in place to ensure it. And so then when something happens and it's you that has, put that patient at danger, or that's how you perceive it, when that happens, suddenly this whole new patient safety world opens up in front of you, where there is the possibility of errors and the need to make change. In my role now as the Global Medical Advisor for Save the Children, we look after our direct healthcare services, and basically our role is to ensure that all of those services are safe. And so over the last 3 years, we had a 3-year strategic period. We've been building what we call our quality framework. So producing policies and procedures and checklists and guidelines, and then rolling these out across several countries, and asking the teams to take them up. And it sounds so dry and so boring, like checklists and procedures and please do this. And so the thing that I've really enjoyed is that we've produced them, we've managed to really get the healthcare facility teams involved, and feeding back to us. But what they've really appreciated is the fact that they said it's given them a voice. So before, there were definitely a lot of the things on the checklist that they were doing and they were achieving and they were ensuring patient safety in those areas. And so now they can say, we definitely do this. We now have evidence and proof from the checklist that we definitely do this. And then the other thing is that they come back and say, actually, but these are areas that we're not doing so well on. Like, actually, we've just realized that if our water doesn't get delivered, we don't have a 2-day reserve for if something goes wrong, and so they were like, these are the things that they're coming back and saying, wow, this is great. Actually, we didn't realize the patients didn't know that their medical records were confidential, and so we've now made sure that they all know this. And so that kind of feedback is amazing. And I think what makes it so great is that the checklists are, they're time consuming, and it is essentially coming from the top down, and that's never enjoyable for anyone. And yet they are really actually enjoying them when they do them, and they're not only seeing the positives, but they're seeing the smaller negatives because there aren't that many, and they're saying, actually, we need to take action on that, and we want to take action on that. And so, you know, I've said to them, you know, if you have any issues, you can come to me, I can provide you with support. And normally they say, right, Josie, you know, we saw this, we've, as an error, we've taken this action, what do you think? And I'm like, that's amazing. And that's, you know, that's what I love. I love it when someone comes and says they've already seen these issues and solved them all already in their way, which means it's definitely going to be, you know, kept in place and maintained and make a difference. One of the biggest challenges I see to patient safety currently, in my role particularly, is time. You know, we're asking our staff, particularly in these countries where we're delivering these direct healthcare services, to take up checklists and procedures and to report medical incidents. You know, and they just, there's not enough time. I mean, they have such a high patient workload, trying to fit in the time to fill out the checklists and then have the time to analyze the results and think up the idea that they should then put in place and then put it in place. You know, it is a big process, and we are achieving it in some places, but I think in others the real issue is that time. And I think, you know, as a medical profession, you're time short everywhere because the patient comes first, you know, and so you are seeing that patient and you're doing everything you can to ensure that patient's safety. If you prescribe something and then you notice you've made an error, you adjust it and you're like, whew, ah, okay, good, I caught that. And then you carry on because you're so busy, you don't think of reporting that as a near miss. How do we provide them with the time and the ability to kind of, yeah, highlight all of those things so that, you know, others outside of that manic healthcare setting can then support them to improve those. I think at Save the Children, in the global medical team, our next 3 years is very much increasing our the countries in which we're working in regarding patient safety. So we've been focusing on our direct healthcare services because those are the easiest ones to get involved in. But we have huge numbers of partnership services, either with other NGOs or with the Ministry of Health. And we're looking at the partnerships. We really have to work with the partner to figure out the best way to move forward on patient safety so that it will be maintained, even that if that partnership doesn't continue or if the partnership changes. But I do think that there's a lot moving forward in patient safety, particularly now. For example, we work at the healthcare facility level, whereas now with the WHO and their quality focus, they are working at the more Ministry of Health level. And so I'm hoping, and Save the Children and the WHO are currently working in collaboration, and we hope that with the WHO working at that Ministry of Health level and producing those policies, and us at the healthcare facility level, then we can really meet in the middle. As long as we can align them, it's going to be amazing to be able to put that into place and see a kind of quality and patient safety theme that runs from the Ministry of Health to all of the healthcare facilities, whether they're in partnership or not. I could change one thing in patient safety, I think it would be that we have a more open and just culture. I think we still have a culture of blame. And so it still makes people nervous to admit when they think there's been a patient safety issue. At Save the Children International, we have a medical incident reporting system, and you are able to report anonymously, which is what the majority of our staff do. And I mean, that's already a great step that they're reporting. But last year we had our first frontline healthcare worker report themselves, and we were like, yes, we're going to celebrate. And it sounds so silly, but like the fact that that person had the confidence to say, yes, I made this error, to me means that we've really made progress in the fact that they were able to have that confidence to do that and didn't think that there would be any repercussions, or or that they would be essentially blamed. And I think that's what I also really want to work on in the next 3 years. The other thing when you're working across countries is that blame is very different in different cultures, and the way it's seen and perceived. And so we've got there in one, which obviously needs more work, but now we need to get there in the rest. I think that it would massively increase people's discussions on patient safety. So things I do outside of work that make me think about patient safety, I think I've recently in 2020, my partner and I moved to the French Alps, and so we now live in the mountains. And actually I hadn't thought about all of the kind of risk analysis you do when you live in the mountains. For example, we go ski touring, and so you're looking at the weather beforehand, where you're going to go, where you think the snow is going to have melted, what the avalanche risk is, how many of you are going to go. So there's all these kind of objective risks that you have and you have to look at, and then it's and that's what we do in patient safety. We have all of those objective risks that we look at, but then it comes down to those subjective risks. Like if the person I'm going ski touring with turns up and they don't have their transceiver, and they don't have a shovel and a probe to be able to dig me out if I get caught in an avalanche, then I'm not going with them. And suddenly I was like, that's something I don't think personally I possibly look at enough, those subjective risks in patient safety. And so I think that's something that I've started looking at more as I've been developing particularly these checklists, and thinking, right, so if this is me as a healthcare worker, and then asking one of our healthcare workers to quickly use it and say, right, what did you skip? Like, what did you hate? What did you just tick because it was easy to tick? Like, and that I'm really learning from. One of my mottos recently, that all of my country office teams know, is that you have to make the right thing to do the easiest thing to do. And so we've got to look at all those subjective risks, because otherwise people are going to take shortcuts, and they're not going to do it. I think I do like to take risks. As in, I like skiing, and this summer I learned to paraglide. I used to skydive, and I think often when people think of patient safety, they think of people really sticking to the rules and not taking any risks, or not necessarily or always looking for the risks. And I think we generally do that. Like, I always look at the risk, but you've also got to look at the benefit